I researched a disorder called Oppositional Defiance Disorder. In this presentation, you will learn what ODD is, what it looks like, how it's identified, and also some strategies and ways to help accommodate students that might have oppositional defiant disorder. ODD is an exceptionality. It's not just a child that's unruly, it is an actually documented disorder in the Diagnostic and Statistic Manual of Mental Disorders, which is the book containing standard criteria for the classification of disorders. There are many possible signs of ODD in children. They can be angry, persistent, and have disruptive behavior. They often lose their temper. They deliberately try to annoy people. They're often touchy or easily annoyed by others. They can be defiant and refuse to comply with adults' requests or rules. They often blame others for their own mistakes or their own misbehavior. And they're often spiteful or vindictive. And this type of behavior is consistent. It's not just with one person, it can be with anybody, with parents, with teachers, friends, peers. It's a common behavior that they show. There are many possible signs of ODD in children. The prevalence, it tends to show before the age of 8, but it can sometimes be later. The least common time for signs to show would be right before the early teen years. It is more common in boys, and the latest research explains that it can affect approximately 20% of all children. And again, the signs tend to appear before the child is 8 years old. There are no set factors to predict this disorder from happening, but experts do think it can be caused from a combination of biological, physiological, and social factors. It's common for children with oppositional defiance disorder to have other behavioral exceptionalities as well. Other commonly associated exceptionalities would be attention deficit hyperactivity disorder, or ADHD, depression, anxiety, and other learning communication disorders. It could be difficult to recognize the difference between a very unruly child and a child that could have oppositional defiant disorder. Each child is different. Children come from different backgrounds. All children have different histories and each have experienced different situations. Observations are the first step in diagnosis to see where the child has been, what they've experienced personally, what their history is. There is a formal test that can be used to help diagnose the exceptionality called the Oppositional Defiant Behavior Inventory, or ODBI, which can be found in the Psych Test database online in our class's website database list. Diagnosis of ODD does need to be done by a professional with the help of caregivers, parents, and other adults important in the child's life, such as family members or friends. How the child functions socially with peers and their family is also important. Parent characteristics, cognitive skills, language processing skills, these are all factors as well. And caregivers and parents need to help provide information to the professionals about the child's moods, their ups and downs, their obsessions, their anxieties, anything that might affect their mood or behavior. The Oppositional Defiant Behavior Inventory Questionnaire rates 18 specific behaviors that are counted by how many times the behavior occurs in a week. Rarely would be when the behavior happens once per month or less. Sometimes would be once per week. Often is 2 to 3 times per week. And always is 4 times per week or more. This is the actual questionnaire. And as you can see, there are many behaviors listed. The child can have temper tantrums when they don't get what they want. talk back after they're already warned, don't obey, interrupt, doesn't apologize. The list can go on. The Oppositional Defiant Behavior Inventory does not treat the child, but it's a way to begin how to treat the child. Treatment does seem to be individualized according to the individual differences each child faces. Professionals, caregivers, and parents need to help pinpoint the exact time a child has difficulties, as well as figure out what triggers the symptoms. Then different behavioral strategies and techniques can be used to help the triggered behaviors. So how does this affect the child that has oppositional defiance disorder? Children with ODD can have a very hard time dealing with everyday situations that wouldn't normally affect a person's emotional and social state of mind. How do you help a child that's been diagnosed with oppositional defiance disorder? It all goes back again to individual child observation. Again, since each child with ODD may have their own triggers which cause them to lash out or be angered, each child will have different needs that will need to be met to help them work through times when they're struggling. Behavior can vary and change depending on the environment. Looking at the students' behavioral patterns at school are important to figure out how to handle the behaviors, as well as at home. A great way to pinpoint these is to keep track of the occurrences on paper. Checklists can be made, rating scales, questionnaires like the ODBI. You can even just write down in a journal when children have behaviors that seem to be negative or angry. Some important things to write down would be what causes the behaviors or what triggers the behavior to happen, when the behavior occurs, time, for example, and timing. Does it happen consecutively in the morning? For example, could a child in school who constantly has an interaction with another student at 9 in the morning roughly every day, maybe the child's hungry, maybe the child is triggered by different physiological reactions. There's many things, and writing this down could help figure that out. Keeping records can help the students and the teacher and the parents understand how a child might react or work through a disruptive behavior. But consistency is really the key to keeping the negative behaviors at bay with children with oppositional defiance disorder. Inconsistencies in expectations and consequences can make it more difficult for the child to learn boundaries and learn how to regulate themselves. Parents and teachers need to have clear expectations for what's behavior. These kids really need to know what is expected of them. And they need to understand that there are consequences, and they need to be clear consequences, which will affect what happens if the child doesn't meet expectations. One example that I could think of is in my own household as well. If a child doesn't want to go to bed, and it's their bedtime, and if the child asks the parents to watch TV, the parent says, no, it's your bedtime, and the child says, no, I want to watch TV, and throws a little fit. The child says, no. The parent says, no, I'm sorry, you're not going to watch TV. Well, the child throws a bigger fit, cries even harder, and eventually the parent gives in, and the child has won the decision of watching TV after they've been told no. This makes the rules very hard to understand and very hard to follow when expectations and consequences are not set. One way to ensure consistency is by making sure that parents as well as teachers have the same general expectations for acceptable behavior. Now, granted, you can't set rules for a bedtime at school, but it can be the same general scenario. If you do not follow directions, this is your consequence. If you do not follow the rule of going to bed, this is your consequence. If you choose to argue and throw a fit, this is your consequence. Expectations for home and school can go on this contract. Similar boundaries make learning expectations easier for students, and all adults in the child's life will be aware of the behavior in all settings. Having parents and school officials work together as a team, everybody knows what's going on in every place. Each adult knows the child in a different way as well, so each child might be able to identify different educational, social, emotional, history, and background, as well as any other concerns that they might have in the learning environment or at home. And if there is an IEP team set for the child, their input would be very beneficial in making decisions in terms of lessons and daily classroom rules and expectations. So how can teachers help students with oppositional defiance disorder? Children with ODD might not be very motivated to learn, especially if they are in an angry moment or frustrated or having a hard time concentrating. Having a purposeful, engaging curriculum that really ties the real world into their everyday learning is necessary to help keep the child focused on their learning goals. The teacher can get to know each student's interests and experiences and use them in the curriculum. This will help them feel like they're a part of the learning process and their input and values and likes are important. Children with ODD can be more aggressive with students, and this could really affect the school day. The teacher can work on skills and techniques with the student to learn how to control themselves in angry situations or frustrating situations. There are many strategies and techniques the teacher can teach the children, and this could help not just children with ODD, but all children in the classroom. Reminding the students to use their voices to show their feelings rather than show them physically. A popular term for that is use your words, not your hands. I use that in my daycare. Keeping a journal to keep track of thoughts and feelings can help students learn how to self-regulate. And then teaching deep breathing techniques also is a good way to teach a child how to calm down. One technique I like to think of is take a deep breath and blow it out slow as if you have a little teeny tiny straw in your mouth. That really can calm down the body, and it even brings down your blood pressure. It does many things good for the body. One of the most important things we can do for our children with or without oppositional defiance disorder is to listen to what they have to say. Being a good listener is key in all communication and can only make difficult times and situations easier for everyone involved. It's not always easy to be in a situation with a frustrated, angry, unruly child, but it is, again, a disorder, and it's something that needs to be worked through to make it easier for the child as well as everybody involved. As teachers and parents, we will all face many challenges in our careers and in our lives. Working together for the sake of all children, making necessary accommodations and modifications, we can help make life easier for every child. Teaching strategies and techniques to help deal with anger, frustration, and any negative feelings in their lives can really help a child with ODD, oppositional defiance disorder, really learn how to regulate their emotions and take control of their lives every day, making school and home easier for everyone. I did get all of my images off of Google Images, and there is a whole list of some really good websites here where I got a lot of my information as well. So that would be it. Thank you.